Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. And Dr. Wesley Shankland is back in the studio with us here from the Lima, New Bremen, and Spencerville Dental Association. So good morning to you.
Good morning, George. How are you?
I'm doing just terrific,
Great.
sir. Now, we've got something to talk about. It's cracked tooth. What causes it?
Cracked tooth syndrome is an interesting disorder. A lot of people may go to their dentist and have a sore tooth or a pain, for example, in the upper right area of their face, but they can't tell what tooth it is. And that's a problem for the dentist. It's hard to tell what it is. It doesn't hurt all the time. It may be a dull aching. It may hurt only when they bite down or chew. It may hurt only when they drink something hot or cold or something sweet like a soda pop or something like that. But it's not a pinpoint area that's just like a real bad toothache.
Yeah, the question here, the patient has a specific symptom of one?
Yeah. Some of the symptoms they get when they bite down, it bothers them. If they're just talking like we're talking, not a problem.
Right.
But if they bite down, they have pain, especially if they drink something that's hot or cold or sweet. It seems to stimulate it, see. And the problem is enamel on our teeth is like glass or ice. It's laid down like prisms. And if it fractures, the fracture may propagate a long distance or a short way. And so we all, at our age, we have cracked teeth in the enamel, but it can crack into the dent and the underlying organic tissue below the enamel. That's where you have discomfort if you have it exposed.
It's difficult to spot it then, right?
It's very difficult. When a person comes in, one of the worst things the dentist wants to hear is, "Doc, I got a toothache, where is it? I don't know." Or it's on the right side of my face. That's hard for us to tell what it is just because of the way we're created, the anatomy.
Right.
And so we have to do several kinds of tests. And sometimes your dentist will do something and have you come back later on in a few days and look at you again.
Right.
So we see this, and a lot of times it can cause undiagnosed facial pain, head pain, eye pain. And a lot of people think it's sinusitis. It's not, but they may be diagnosed as sinusitis. So it can cause some undiagnosed facial pain that maybe your primary care physician sees, but your dentist can help.
What kind of treatments are there?
Sometimes we have to put a crown or a cap on the tooth. Sometimes, if it's bad enough, we have to replace the filling or even extract the tooth.
Ooh.
So sometimes it can be broken enough down below the gum line into the bone that we can't save the tooth. Then we have to talk about replacement of that tooth.
Very good advice. Any
Thank you.
final words?
Yeah, keep smiling, sharing, and caring, George.